So in a inborn error of sulfur containing amino acid metabolism, this is a last disorder, that is a cystinuria. Normally there is a excretion of cystine in urine is less, but if the patient is suffering from cystinuria, the urine concentration of the cystine increases by 20 to 30 times of normal. And here is the increased excretion of dibasic amino acid. So these are the cystine, ornithine, lysine, and arginine. So it is called as a COLA, that is a cystine, ornithine, lysine, and arginine. So it is excreted in a urine. And why? Because there is a impaired reabsorption of above 4 amino acid from renal tubule. The renal transport defect is there. There is a impaired or there is a impaired reabsorption of above 4 amino acid. That's why the cystine, it comes into urine. That cystine, it is a relatively insoluble. Now this cystine, it is a relatively insoluble amino acid which may precipitate in a renal tubule, in a ureters and a bladder, so as to form cystine stone. Here there is a cystine calculi which is formed in a renal tubule, in a ureter and in a bladder. Okay. Now normally there is a filtration and reabsorption, but in case of this cystinuria, there is an increased excretion of this cystine, lysine, arginine, and ornithine. Cystine, it forms a cystine stone, and this cystine stone, it accumulates into this renal pelvis. It may come into ureter, bladder, or urethra. So depend upon the site of stone, there will be a pain. So here the pain, it may be renal colic, it may be because of the stone in ureter, there is ureteric colic. The pain, the stone may be in bladder or it may be in urethra. Depend upon the site of the stone, the symptoms will be there. Okay. So here there is an increased excretion of cystine, lysine, arginine, and ornithine. Then what about the investigation? So by urine investigation, you will find that there is a detection of the hexagonal flat crystals. Hexagonal flat crystals are seen in a patient who are suffering from cystinuria, and the care should be taken that patient is not taking any sulfur drugs. So sulfur drugs is also responsible for such crystals. So while doing this investigation, ask the patient about the history of any sulfur drugs. Then next test is the cyanide-nitroprusside test. It is a very simple and valuable test where the urine sample is made alkaline with the ammonium hydroxide, and then we are adding a sodium cyanide in it. This sodium cyanide reduces cystine if present to cysteine. Cysteine, by the action of reduction, there is a formation of cysteine, and cysteine, it gives magenta red color. There is a magenta red color is formed whenever there is a sample contains cysteine. Now the test is a cyanide nitroprusside test where we are taking normal sample and patient who is suffering from this cystinuria. So if the patient is suffering from cystinuria, here you can see there is a magenta red color complex is present. Why? Because the cystine is there. And this is a positive nitroprusside test, while if there is a no cystine, cystine is absent, so there will be no red color. So if the test is positive, it means that sample is containing cystine. If the test is negative, there is a no red color complex. It means that there is a no cystinuria. Okay. Now about management of cystinuria. So here first thing is a surgical removal of stone. If the stone is there, that can be removed by the surgical treatment. That stone is easily removed, and if the size of stone is small, it's less than 5 mm, you can remove by diuresis, and if the size of stone is more than 5 mm, the surgery is required. And depend upon the clinical feature, you have to do the management. And once the stone is removed, then prevent the formation of stone. You have to prevent the formation of stone by drinking large amount of water regularly, because this large amount of water, it prevents the precipitation of crystal of cystine, so there will be no stone formation. This is about cystinuria, and please like, share and subscribe my videos. Thank you.